Okay, let's try this again. Okay, hello everyone. It's Friday, January the 29th. We've got 53 more great West Virginians that we've lost. Again, the numbers were 77, 83, like that and everything, and the numbers are getting somewhat better, but losing 53 West Virginians since Wednesday is an enormous number, and we want that to come down. We have indicators along the way where things are better, and I'll get to that in just a few minutes, but I'm going to read each and every one of these right now. Our 1954th death is a 70-year-old female from Jefferson County. Our 1955th death is a 59-year-old female from McDowell County. Our 1956th death is an 82-year-old female from Hancock County. Our 1957th death is a 66-year-old male from Monongalia County. Our 1958th death is a 70-year-old male from Mercer County. Our 1959th death is a 74-year-old male from Hampshire County. Our 1960th death is a 74-year-old female from Ohio County. Our 1961st death is an 82-year-old male from Upshur County. Our 1962nd death is a 74-year-old male from Berkeley County. Our 1963rd death is a 73-year-old male from Harrison County. Our 1964th death is a 68-year-old male from Raleigh County. Our 1965th death is a 53-year-old female from Marshall County. Our 1966th death is an 89-year-old female from Mercer County. Our 1967th death is a 91-year-old female from Harrison County. Our 1968th death is a 60-year-old male from Hancock County. Our 1969th death is a 65-year-old male from Cabell County. Our 1970th death is a 66-year-old male from Wood County. Our 1971st death is a 92-year-old female from Mercer County. Our 1972nd death is a 57-year-old female from Preston County. Our 1973rd death is a 59-year-old female from Upshur County. Our 1974th death is an 84-year-old female from Marshall County. Our 1975th death is a 93-year-old female from Hancock County. Our 1976th death is a 70-year-old female from Upshur County. Our 1977th death is an 83-year-old female from Cabell County. Our 1978th death is a 78-year-old male from Harrison County. Our 1979th death is a 69-year-old female from Putnam County. Our 1980th death is a 78-year-old male from Ohio County. Our 1981st death is a 79-year-old male from Ohio County. Our 1982nd death is a 79-year-old male from Ohio County. Our 1983rd death is a 72-year-old female from Fayette County. Our 1984th death is a 77-year-old male from Taylor County. Our 1985th death is a 64-year-old male from Tyler County. Our 1986th death is a 68-year-old male from Wood County. Our 1987th death is a 78-year-old female from Wood County. Our 1988th death is an 82-year-old male from Kanawha County. Our 1989th death is an 89-year-old female from Wood County. Our 1990th death is an 86-year-old female from Harrison County. Our 1991st death is a 69-year-old female from Mercer County. Our 1992nd death is a 67-year-old male from Cabell County. Our 1993rd death is a 74-year-old male from McDowell County. Our 1994th death is a 64-year-old female from Wood County. Our 1995th death is an 84-year-old female from Raleigh County. Our 1996th death is a 79-year-old male from Kanawha County. Our 1997th death is a 67-year-old male from Randolph County. Our 1998th death is a 71-year-old male from Wood County. Our 1999th death is a 73-year-old male from Logan County. All of them have been really tough. But can you imagine? Can you really just imagine 2,000 people dying in West Virginia? 2,000 mostly of our seniors, 2,000 of our wisdom, 2,000 of the people that guided us through decades in their life. It's really, really sad. The 2,000th death in West Virginia is a 71-year-old male from Barber County. The 2001st death is a 76-year-old male from Harrison County. The 2002nd death is a 57-year-old female from Mercer County. The 2003rd death is a 67-year-old male from Lincoln County. The 2004th death is a 69-year-old female from Monongalia County. The 2005th death is a 49-year-old male from Jefferson County. And the 2006 death is a 78-year-old female from Wayne County. Now, I want to jump right back up here to just one thing, just a second. When I read the 1981st death, it was a 79-year-old male from Ohio County. The 1982nd death was also a 79-year-old male from Ohio County. I hope that's not a misprint, and well, you know, I hope that we haven't had two people from the same county, the same age, and I know that's perfectly possible and everything, but I just wanted to make sure to that family that I wasn't reading some kind of typo, or to those families. We have 905 new positives in the last 24 hours. Our daily percent positivity rate has dropped significantly to 4.66. Our cumulative positive is at 5.6. It takes a lot more to move that. Our active cases are 22,570. The number of daily active cases now in West Virginia has gone down 13 straight days. That's great. Our recovered cases are 94,891. You got to put that graph up, Jordan, you know, on that. If you'll look, the top line on the top graph is recovered cases in the light blue. The bottom line is the active cases. With active cases going down and the light blue line going up, it gets wider and wider, and that's just what we want to have happen. We've got 519 patients hospitalized now and 132 in the ICU units. Our RT number is at 0.93 today. That's still really good. You know, we're the 27th best in the country, but it's good news for our whole country. It seems like with 44 out of our 50 states under 1, which is the key to this whole thing, it's showing signs that we're getting better, and we're getting better across our entire land. I tell everybody 65 years of age and greater, if you got a sniffle, headache, tiredness, whatever, please go get a test. Go get a test really, really, really fast. You'll see, you know, I mean, Jordan, come back up with that state map just one second. You see from our state map, we've picked up another county in green, hallelujah, and we're still struggling with our border counties somewhat, you know, still being in red, but for the most part, we're getting better. We're getting better. We're picking up yellow counties now, and we're moving in the right direction, I hope and pray anyway. As far as our vaccine distribution update, this week we're still doing incredible work on the administration rate of getting shots in the arms. We're at 101% of the vaccines received that are in somebody's arm on the first round doses, and we're nearing 60% on the second round doses. We're leading the nation in every way you can imagine. We've got a total number of doses that are in somebody's arm in West Virginia right now of 242,437 doses. And in the last 24 hours, we administered 15,379 in the last 24 hours. West Virginia continues to lead the nation because of our partners at the local and the county level, and I thank them with all in me, and the great work the National Guard's doing as well. You know, all of our counties and community partners play an incredible role in the value of making this all happen, and we've made it happen. It's great stuff. I couldn't be more proud of you than I really am. From our nursing homes, I am unbelievably happy to announce today that we have completed all of the second round doses in our nursing homes and assisted living facilities on all those that have been willing to take the vaccine. They should have all taken it and everything. We can't make everybody take it, but we know the percentage was overwhelming on the number that took it. And we're starting to see some positive impacts. The number of infections in our nursing homes and assisted living have really decreased. We are down to 55 active outbreaks in our nursing homes and 18 in our assisted living facilities. That's great, guys. I mean, it is great. And we've cut the number of active outbreaks in nursing homes by 50% since the beginning of January. In 9 days, in 29 days, we have cut the active outbreaks in our nursing homes by 50%. It's great work. A lot of people are really pulling the rope here. You know, as far as our vaccine scheduling system that's up and everything and working, you know, all West Virginians age 16 and above can pre-register to get their vaccine through the new scheduling system. Since we have launched our West Virginia COVID vaccine registration system, there's been 133,000 West Virginians get pre-registered since Monday. I encourage all West Virginians to pre-register. It takes about 10 minutes or a little less than that to get pre-registered. If you have already put your name on a wait list with the local health department, local pharmacy, or other organization for a vaccine, go ahead and pre-register in the Everbridge system also. You will not lose your spot in line. This helps us to make sure you're counted, and it gives us an additional demographic data to use to make sure the vaccines are going to the right areas. This will not delay you getting a vaccine, and it may even speed up you getting the vaccine. So again, even if you are already on a wait list, go ahead and pre-register with the Everbridge also. You do not and you will not lose your spot in line. You can pre-register online, or you can call, if you don't want to do it online, the COVID vaccine info line, and they'll help you get pre-registered. For those that don't want to go online, you can still call our staff, and they'll help you with the information to get you registered and get you moving forward here. On the Saving Our Wisdom clinics, the community vaccination clinics as part of the overall or the Operation Save Our Wisdom are now open to all West Virginians 65 and above. We are continuing this week's 25 clinics in 17 counties to serve all West Virginians who are 65 and up. There's so many of these events taking place over the weekend as well. We do not have enough doses to vaccinate all West Virginians right now, but you can bet your boots we are screaming our head off to try to get more and more and more. You know, you see us all over the national news and everything. All that does is perpetuate West Virginia's doing it right, and it helps us to try to get more and more and more doses of vaccines as well. Within the next 2 weeks, we will use the Everbridge system to start scheduling West Virginians to get vaccinated for these clinics. We will continue using our current list until then. Next week, There will be vaccine clinics in all 55 of our counties, like I've told you, and they will receive a number of vaccine doses based on the population in that area or in those counties. This will make sure that our limited supply of vaccine gets to every corner in the state. I am working every day to see that we can get more and more vaccines, and so far, there are 84,791 individuals in West Virginia, 65 years of age and older, that have received their vaccine, and there's 16,000, well, let me make sure of this. Well, there's 16,951 that have received their second or 80, and you're sitting there and you're trying to figure out what to do, and you're watching the news, and over you see this many people died, and you hear me read the ages, and it's you all over the place. And you're worried and you're concerned, as you should be. And the national news and the state and all of us are telling you you're not going to be able to get in line to get your shot until April. And you're thinking, dag, there's a good chance that I'm not going to make it here. And there's a good chance I'm going to get this. And then if I get this, I know what the process is. You end up not being able to breathe, and it really ends up bad. The outlook was not good. And the outlook was a lot of hopelessness and surely a lot of anxiety. So for this, we have moved and we pivoted, and I am immensely proud of all those that put in the licks and decided and helped us decide the course to move. I apologize for sitting on everybody and absolutely demanding that we move, and we move now. But I am very proud that I did that, and I'm very proud of the work that all the medical team and all those that are out there in the guard and everything, all the healthy people and everything that did this. 84,791 individuals with the first shot. 16,951 with the second shot. How many people's lives did we save? Was it 10,000? Was it 3,000? Was it 25,000? How many did we save? What's the price of a life? No one can value that. We've saved a bunch of people, and we're going to continue to do exactly just that. Again, thanks to everyone that's been a part of this. We have a letter from our congressional representatives, and I want to thank them. On Wednesday, Congresswoman Carol Miller was joined by Senator Capito and Senator Manchin, as well as Representatives David McKinley and Alex Mooney, in sending a letter to the Biden administration urging prioritization of West Virginia in the next round of COVID vaccine distribution. The letter cites West Virginia's record for successful vaccine distribution and the high number of at-risk West Virginians as reasons for the request. I want to thank them all the congressional delegation, for helping to push us to try to get more and more vaccines. Okay, I'm going to just jump over here real quick. I just had a note and everything, that there's and I really shouldn't pay any attention to the rumors that go around, or maybe the advice that's wrong that people are telling people. It appears now that there's somebody driving this boat and everything in regard to our teachers, and in regard to them not being able to get vaccines, from the standpoint of being under the age of 50, or maybe even those that decided not to get a vaccine that were over the age of 50. Well, now they're just out of luck. And I don't really have any idea why or what would motivate someone to perpetuate these either these rumors or these incentives, to try to drive your message home. Because you see, at the end of the day, what happens, when you have blood spilled on your hands? What happens when you have a beautiful person that's 45 years old, or a person that's 70 years old, that's a teacher or a service personnel person? The person that's 70 decided not to take the vaccine, but now they're having second thoughts, and now they decide they want the vaccine. Or what if you're the 45-year-old and you had some level of heart problems and heart issues you were worried about? You were worried about what's going on with your family. You're worried about the kids at school. You're worried about things. And then you're told, well, you're just out of luck. You're not going to get a vaccine shot. And then you really become traumatized, and God forbid, somebody has a heart attack. We lose somebody. With every single one of these bad rumors or bad information or whatever the situation may be, coming from union bosses or coming from people that have other motivations or ulterior motives as to going to school or going to your job or whatever, it's just the wrong information. Now, just hold on just 1 second. They've sent me a note here, and I want to make sure. Okay, I'm back to you. Say what? I'm sorry? Just wanted to make sure that the note that they sent me here was exactly what I was referring to. I'm going to make a statement. I'm going to tell you point blank, and I want every teacher, every service personnel to listen to me. Absolutely, if you don't have your shot and you're wanting a shot, you can register on Everbridge right now. Being told that you can't register on Everbridge is ridiculous. And you will be treated as essential, not public. You will be treated as essential. Do you see, we made all of our teachers essential before. That's what we did in the very, very beginning. But then we elevated the very people that I read every day that die. We elevated all those 50 and above to being super essential, and absolutely super prioritized those employees 50 and above. Now, and then we offered vaccines to all of them. And that's what we did we not? Now, some of those that were 50 and above decided not to take the vaccine. Now you may very well want to have the vaccine, and we're trying as best we can to get vaccines all over the place and do everything we can. And what I've told you is just this, is as you will remain essential, you can absolutely pre-register as essential and get right in the system and get your shots there as well. Now, for those that are telling you can't do that, they're not telling you the truth. From the standpoint of those under the age of 50, from the standpoint of those, I said, and I stand exactly by exactly what I said if we have extra doses of vaccine, and we have done this, as we've been giving the shots out at the schools or wherever we were, and we had extra doses in the vials, and we had people not show up or cancel their time that they were coming there, and we had extra doses. Instead of throwing them in a trash can, we already gave them to a bunch of teachers and service personnel that were under the age of 50. Now, hear me out loud and clear. As soon as we get vaccines enough to be able to double back and get all the people that are under 50 or all the people that passed on the first go-round that are over 50 we'll be there doing it. We'll be there just as quickly as we possibly can to do it. You know, as of 5 p.m. today, all school employees age 50 and above who had requested the vaccine during the first round will have received it. And let me be perfectly clear, all school employees who are scheduled for a second dose will absolutely get their second dose and will receive them at school where they received their first dose. So, just to go back and clean up this garbage, and that's all it is when people tell people stuff to scare them and everything. It's just plain garbage. If you have gotten your first shot, you will get your second shot with the same place right on time. Absolutely, without any question, you can continue to pre-register. You are identified as essential. If you passed and didn't get the first shot and you were older than 50 or you're under 50, you are still considered as essential. And I would tell you, pre-register and go on right now and pre-register and quit believing somebody trying to convince you that if you didn't get it the first time, well, they're not going to give it to us and we're not ever going to get it if we're 50 and under. That's ridiculous beyond belief. And as soon as we get vaccines in to where we have enough to continue our clinics and continue all the different models that everybody's doing, we'll double right back and get the people that are under 50 as well as the people that missed it or decided not to take it that now want to take it that are older than 50. I can't be any more clear. I can't be any more clear. You know, absolutely, I do not know why in the world we keep trying to circulate this information. But, you know, I think Clay maybe is on. Maybe we ought to go to Clay right now and let Clay, you know, add a little bit to what I've got.
Well, thank you, Governor. As we prepared the priority list that the governor approved and again asked us to focus on saving lives and reducing disease and promoting well-being, maintaining capacity and function of healthcare and of the community sectors, what we found was looking at the CDC's recommendation, looking at other countries like the United Kingdom and our own data, that half of our deaths came from nursing home residents, that our average age of death is 77 years old, that people in West Virginia over 70 years old account for 77.5% of our deaths with COVID. People over 60 years old in West Virginia account for 92% of our deaths with COVID. And people over 50 years old account for 97% of our deaths from COVID. The Advisory Committee for Immunization Practices from the CDC recommended the two groups be focused on as first priority were people in nursing homes and the staff because of the spread, and also people in hospitals. And so per those recommendations and with the governor's okay, we really focused at that first group with hospital folks and nursing home residents. And as everybody knows, we were the first to immunize nursing home residents with the first dose and now with the second dose. We are seeing a reduction in the hospitalizations for people from nursing homes and seeing a reduction slowly in deaths, which is very encouraging. And then we started to look at other critical sectors like community sectors, like teachers, food workers, utility workers, people in the funeral home industry, people in other healthcare sectors. And we then suggested to the governor that we really focus on the over 50-year-old group, because that's a group that's dying. And that we also, as we have said many times, we didn't want to be sequential. We wanted to be overlapping. And then we also wanted to try to turn to this group of elder West Virginians. And we started with West Virginians over 70 years old, because again, that's 77.5% of our deaths. And I'm so proud of the fact that we were able to immunize, all the teachers over 50 who decided that they wanted to take the vaccine, but that we've immunized over 85,000 West Virginians who are over 65. And those are the group that are dying and going to the hospital. So it was really never our intention to immunize all of the people in these other sectors until after we got through our elderly population. So the teachers and other critical workers under 50 were in phase 2B of our initial plan. But obviously, we've looked very carefully at all of the epidemiology around the country, working with Emily Oster, who has the best handle on school safety, who's at Brown University. And we've looked extensively at our own data in West Virginia schools from the previous year. And what we found is that in children in K through 8, nationally and also in West Virginia, the spread of COVID in the classroom, with people wearing masks and staying distance and doing all the right mitigation measures, including testing, contact tracing, quarantining, cleaning, that the rate of spread is very, very low in the classroom. And in fact, in the classroom setting is much lower than the transmission rates in the community. Because initially we thought, well, the community transmission rate, how quick COVID was spreading, was going to be the thing that drove spread in the schools. But what we found is because of the structure of the classrooms where everybody wearing masks and doing all the right things, teachers and school officials doing the right things, that spread is really low. So while we really empathize with all of our heroes that do great work every day, including our teachers, we believe that the classroom is actually a safe place to be at this point. The vaccines are an extra protection, but not a requirement to get back in the classroom. And certainly we want to vaccinate all West Virginians, but right now we just have a shortage of vaccine. And so we've really tried to focus on our priority to save lives, improve well-being, protect our hospital capacity, because we know if we overwhelm the hospital capacity, then our death rate starts to go up, and then also try to maintain those functions in the community and the hospital. So Governor, I'll turn it back to you.
Okay, thank you, Dr. Marsh. I just add one more thing, and you know me, I just try to speak in plain language and absolutely just speak the truth, but to all of our service personnel, all of our teachers and everything, I thank you for really the job that you're doing. You've done a good job and everything. I would not let the noise affect the job that you're doing, and it is tremendously important beyond belief. We all know that this thing, we can't be absolute. We can't make it perfect. We know that, and we also know that just how precious our children are and how just incredibly behind that they're getting. I know that, the needs of our special needs kids, and I know that the potential abuse or bad things that can be happening maybe, if we don't go to school. I know from the standpoint of how you move around in your neighborhoods as teachers or service personnel. I know how you move around in the stores. I know without any question that the science and the medical community tells us you're safer there at school than about any place you could possibly be. Now, with all that being said, what we did here was just to absolutely come up with another level of an insurance policy. The insurance policy, the additional level was just this. We said, tell you what, in addition to the fact that the science and the medical community knows that it's safe, and in addition to the fact that we know how much it's hurting our kids and our families and daycare and economics and everything under the sun to not go to school, in addition to that, tell you what we're going to do. We're going to vaccinate all of our service personnel and all of our teachers that are 50 and above, and on the list, basically the level of the list that we read every single day. And we offered it, and we came, and we did it. And in addition to that, if we had extra ones in vials or whatever, we'd give it to the 50-year-olds under 50. And on top of that, we've even said over and over and over, there was a point not very long ago that, our great general and our great, coronavirus czar and myself, we all hoped we were going to get 110,000 doses, additional doses in a week. And they didn't come, did they? Everybody is doing every single thing they can do. Don't listen to the noise. All you've got to do is know that you're still classified as essential. Absolutely register as quickly as you possibly can if you've not. Know if you have been vaccinated, you will get the second dose on time, right on the money. And absolutely, we will get to all of you as quickly as we can come up with the doses to be able to keep everything going and get to you as well. We'll do it. I've said it over and over and over. It had nothing to do, giving you these doses had nothing to do with the condition of being back in school. We wouldn't have put you back in school in any way if we thought it was unsafe, but we can't make it perfect. It's not perfect at Walmart. It's not perfect anywhere. You're not perfectly safe in your homes. It is not perfect. And absolutely, we've got to just remember that and continue to try to do any and everything we can possibly do. Now, I hope we've cleaned that up. My goodness, if we can't, if we haven't, I don't know how to make it any plainer. I want to go back. I read this 2 times. The 1981st death was a 79-year-old male from Ohio County. I read the 1982nd death is also a 79-year-old male from Ohio County, and I read that. Now they tell me in error. I apologize. I apologize for the misprint. The 1982nd death, the 1982nd death is an 83-year-old female from Mason County. So please keep all these people in your prayers. I don't want to mess up anybody's, gender or location or age, because these are great West Virginians and we miss them. And so, like this beautiful lady, 83 from Mason County, remember her, remember all these people, because they've given us so much, and I really want to be so respectful, so respectful to all of them all the time. I want to welcome, with us today, a great man, Reverend James Patterson is with us, and he is with us from the partnership of the African American churches, and he's with us today in the briefing, and he's going to join us to discuss things. He's on our advisory commission on African American disparities and how they've been doing and how we're administering doses to the minority populations. And I'll defer to our great Reverend James Patterson at this time and let him talk a little bit.
Thank you, Governor. I'm walking on water now. I've never been introduced quite like that before. But the Partnership of African American Churches is a nonprofit that's been around for 20 years or so. And we have been funded working with Secretary Crouch to do some surge testing in communities of color because of the community being hard to reach in some instances. So we have been doing that by having 4 testing teams around the state. 3 of them are funded by DHHR, and 1 of them is funded by WVU. And so the way the population of color is, we have 1 team in the Eastern Panhandle, 1 up north, and then there are 2 in the southern part of the state, because a little over 50% of communities of color live in just 5 counties in the state. And so a couple of weeks ago, maybe 3 weeks ago, Secretary Crouch started talking to us about being involved in the vaccine as well. So we right now putting together 4 additional teams that's going to be doing vaccination in communities of color, particularly around people that are hard to reach. So our strategy is simply going to be to have a permanent location in those 5 counties where 50% of the population is represented. And so by permanent, we mean that we will be testing, we will be vaccinating in those counties at least once a week or bi-weekly. And then our units will be mobile, and they will be going to places and communities where people of color are to do vaccinations. We've already talked to the Air Guard, and they have agreed to just support us to the nth degree in terms of anything that we need. And we expect to have the vaccination up and running the second week in February. So that's where we are with the projects and with what we're trying to do as it relates to surge testing and getting people of color vaccinated. And I have been talking with Secretary Crouch and asking him to convey to the governor that with proper resources, we'll be the same way recognized across the country as vaccinating people of color as we are for the general population. We know how to do this, and so we will be making a dent within the next couple of months.
Well, Reverend, thank you so much, and you can put this in the bank, whatever you need, and we're going to continue to do that. Whatever you need, we're going to supply, because we don't want anyone, anywhere that we have an opportunity to be able to reach out to left behind. We're not leaving anybody behind. That's all there is to it. So I appreciate your support and friendship and all the great work you're doing. So God bless in every way. Thank you. Just a few more little cleanup things. Our COVID vaccine info line should be up there, and so you can see what all that is. Reminder about, wearing your mask. Still, that's your best defense other than your vaccine, but you got to still wear your mask. Please, please, please do that. And, all the other things about it is, the taboo about growing antlers or another hand or getting COVID from taking the vaccine is just that. It's just a taboo that we need to not think about at all. You need to get your vaccine. And so I encourage everyone to, if you're 65 and older, just know and I've said it so many times, everybody's heard it over and over, but at the same time, if there's one person that hadn't heard it that just really touches, if you are feeling bad, headache, tired, whatever it may be, it takes nothing to ask somebody how and where I can go get tested. And once you're tested, we're going to know really quick if you're positive or negative. If you're positive, we can get you the antibodies and save your life. For crying out loud, if you're 65 and above, you have got to get tested if you feel the least bit of anxiety or whatever it may be. Just treat it as such of a heart attack or a stroke, and how you would run to the hospital, run to wherever to get checked out. Well, all I'm asking you to do is run and get a test to where we'll know where we can give you these antibodies. All the testing sites are up there. You've got all that and everything where we free test everybody all over the place. And, again, thanks to all of our drive-through pharmacies and the stuff that's going on there. As far as our long-term care facilities, we have 73 outbreaks in our long-term care facilities. That's all better and better and better. We have only 6 outbreaks in our churches in 5 counties. That's Clay, Hampshire, Nicholas, Summers, and Wetzel counties. That's better. Keep that pew in between you. If you're older, think about getting your services online. Let's get through this vaccine stuff and we'll stop this dreaded killer. Our corrections are, have 132 inmates and 38 staff now. Cases at Lakin Correctional have continued to decline, and now they're at 122. That's good stuff. I've told you about wearing your mask. I've told you about getting your flu shot. And I've asked you, please, 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 if you have had to give blood, we need it. We need it really badly. Go give blood and plasma. Please do that. And so that's all I've got right now, and we'll get through the others, and then we'll answer your questions. But thank you so much.
Sure, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. As the Governor pointed out, we continue to have great success. We've gone over 101% of our allocated first doses. Again, that's as a result of the work that's being done at the local level to get that extra dose out of both the Pfizer and the Moderna vials. So we believe we'll end up the week in a significantly good position again and be ready to go next week with our 55 county approach, as the Governor pointed out. I want to thank Marty Wright, the folks from the West Virginia Healthcare Association, all the nursing home and assisted living operators and staff, and the local health departments, and all the pharmacies that helped us. Again, as the Governor pointed out, today we have completed both first and second dose in all of our nursing home and assisted living facilities, and are prepared to begin to work on those residents who come in new to the system going forward, while other places across the country are just now completing the first dose. We think that's going to have a significant impact on us going forward in West Virginia. Also want to point out, many folks have probably heard nationally about a push to bring FEMA and national level vaccination sites across the country. What we are doing here in West Virginia is working with our FEMA partners to provide us the support we need to manage the networks and the clinics and the sites that we have established. In addition to that, FEMA has been an ongoing partner in our Joint Interagency Task Force from the beginning of its stand up. And FEMA has also just recently offered to provide assistance to our call line, to provide additional personnel to help augment our call line if needed. So as the Governor pointed out, again, encourage everyone to please register. Even if you may be on another list, register in our Everbridge system. We want to make sure that we know all the West Virginians out there that want this vaccine, so we can prioritize based on those things that the Governor and Clay Marshall pointed out that we need to focus on to reduce the death rate and the hospitalization rates in our nation. Thank you, or in our state. Thank you.
All right, thank you, sir. Next, we'll go back to Dr. Clay Marsh, our coronavirus czar.
Well, thank you. And just to reinforce a couple points that the Governor has made, we are, and General Hoyer, we are committed to bringing vaccines as quickly as possible to West Virginia. And as we look at the future, it looks brighter. The Johnson & Johnson vaccine looks like it's been effective across the world, 66%, which is really what we would have anticipated, because a similar vaccine, the AstraZeneca vaccine, made like the Johnson & Johnson vaccine, had about a 70% efficacy, reducing the risk of infection. The good news about Johnson & Johnson is it's a one-shot dose. It can be stored at room temperature, which is really good. And in the United States, looking at severe disease, it reduced severe disease, that's death and hospitalization, by 85%. So that's actually really good news, because we anticipate, and that was the results as reported from their phase 3 study, and everybody's been waiting for that to come out. But if we add that to our armamentarium, that gives us another opportunity to immunize even more West Virginians. And because of the stability of transfer, it will make it much easier for us to take that vaccine into parts of West Virginia that may be more difficult to take a vaccine, say like Pfizer, that requires that ultra cold storage. Now, as we look at the impact of these vaccines and the monoclonal antibody treatment, the drug treatment that the governor talks about, Dr. Amjad has worked very hard to try to get much more use out of around the state and has done a great job. There are mutants in the world that now are showing up in the United States. So the United Kingdom mutant is, I think, in 28 states now. We just had the first reported case of the South African mutant that was 2 cases in South Carolina and people that didn't have travel history, and 1 case of the Brazilian mutant is in the United States. And that may sound scary, but remember, this virus is a virus that is replicating all the time. And because it's replicating all the time and it's messy, it makes mistakes. And these mutants are just the results of these mistakes. And these particular mutants are mutants in the spike protein. And that's the part of the virus, the arms, like in the sun, we talked about the body of the virus is like the middle of the sun. And the spike proteins, excuse me, are like the lines that go out the corona. And the mutants allow the spike proteins, which is how the virus gets to our body, to bind more effectively to our cells. So really the key take home for everybody on the call is it makes it even more important for us to be really, really careful in wearing our masks and staying physically distanced, because those same protections protect you against the mutant virus just like it does against the native virus. And ultimately, it really does mean that we have that power in our hands still. And in fact, utilizing that power as a committed, connected state, helping each other, serving each other, is really even more important. And we're really trying to push out every vaccine very quickly, as you've heard the governor talk about, General Hoyer. So as we get more vaccines, and we're confident we'll keep getting more vaccines, then we'll be able to push it out even faster. And as we talked about, we really want to protect the most aged part of our population as much as we can, because those are the people that are dying, that the governor reads the names every day. But please, please, please take extra precautions and take extra care to really be good about staying home if you can, wear your mask if you're out, stay distance. If you have a cold, get tested. It's really important right now that we really hang together during this time where we're getting everybody vaccinated. Thank you.
Thank you, Dr. Marsh. Next to Bill Crouch, Secretary of the DHHR.
Hello, everyone. Good afternoon. We are moving very quickly but cautiously with regard to the Everbridge system. We now have 135,000 individuals registered in that system. As the governor said, we're asking folks at the local level to go ahead and register in that system as well. The reason for that is some of the lists at the local level are not complete. We have a name, we have a telephone number, but we don't have complete information. So we will make sure we match those names into Everbridge, which will ask you for more information with those lists at the local level, so you do not lose your priority or your place in line. So again, we have a lot of people wanting this vaccine, and that is terrific. As the governor said, we want everybody vaccinated. If we had more vaccine, we could move quicker. We are doing everything but begging for more vaccine, and we hope to get that. And as Clay said, when Johnson & Johnson comes out, there will be additional resources for us to move vaccines. So we ask everyone to please be patient. We know this is important. We know everyone wants their vaccination as quickly as possible, and we're trying to do that, and we are doing that, but we're limited in terms of the vaccine we have. So again, thank everyone for their patience. Once you are in Everbridge, let me say again, you will get, you do not need to contact us back. Once you get into the online system, you should get a text or an email back to say you are in the system. We are working those lists to provide priorities there based upon the age of the population, and we will get to you as quickly as we can. Thank you so much.
All right, thank you, Secretary. Dr. Ayan Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is a question for Coronavirus Czar Marsh. And when we get into hurricane season, you'll often see a number of the spaghetti strands and the different models coming up the coast, and they're never really in agreement until the end. Are there similar pandemic predictive models that you look at, and where do they say it's going from here?
Doc, go.
All right, Governor, thank you. And thank you, Paul. So there are a number of models out there. And I think that one of the issues that we've really spent a lot of time on, Paul, is recognizing that this pandemic is a lifetime event. And these kind of events have been called black swan events before, which are really rare events that have catastrophic impact on all of our systems. And what you learn from these events is it's really impossible to establish cause and effect. So we can have many different models to predict, lots of different outcomes. But what's clear is it's really important for us to be very agile, to have very, very open communication. And, the governor does a great job in communicating with the state. And under his direction, we've started under General Hoyer as leadership with retired Colonel Peel, we've started a joint interagency task force, that team of teams idea, where everybody's on the West Virginia team, but we're talking openly and we're sharing information from around the world, around the country, but importantly, from West Virginia. So I'd say, as opposed to spending a lot of time on prediction models, we spend a lot of time on looking at different scenarios and implementing what we think are the best strategies with the governor's approval, and then constantly not being afraid to stop, kill, iterate, change, because we know that ultimately this thing is moving dynamically. And in order for us to do the best job for West Virginia, we also need to be just as capable of adapting in our strategies and our responses.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a couple of quick things. One is a clarification. Both the governor and Secretary Crouch have said, even if you're online already with a local health department or some other list that you're on, go ahead and register with the system with DHHR, the Everbridge system. I'm literally looking at it, and it says, please do not use the online registration system if you've already been placed on a wait list through your local health department or other healthcare provider. You will be integrated into this new system and do not need to register again. So that might lead to a little confusion if you guys could clear that up for me. And secondly, it took us from March until mid-December to reach 1,000 deaths in West Virginia. Now taken from December 16th to January 29th to reach 2,000 deaths. I'm wondering if Dr. Marsh maybe, or the governor, could just talk about that milestone, what it means for the state, what it means for the pandemic, and where we go from here. Thank you.
Okay, I think I can do them both, and I think I can do them quickly, Kenny. But first of all, the reason that we're talking so much about the Everbridge system and everything is because all of us knew about the thing that was online that said don't if you're already on a list, don't register on Everbridge. All that's being updated today. That's why we're talking about it so much and everything. We want you to go ahead and pre-register, and that was just a mistake and everything that we've cleaned up now. And the other thing is Kenny, from a standpoint of West Virginia, it took, I don't know, probably 9 months to get to our first 1,000. And then very, very quickly, within 2 months or less, now we're at another 1,000. And the net of the whole thing is we've got to know in West Virginia we're not immune. West Virginia is the third oldest state with the most chronic illnesses, and we've known that all along. We don't have an ocean that's protecting us. In this situation right here, our nation has an assault going on all across our nation. In the month of January alone, we will lose 80,000 plus Americans. We have greatly surpassed now 400,000. And I can remember just like it was yesterday and I give him a ton of credit. You know, a lot of people are throwing rocks at President Trump, but I know that they did stuff from scratch. They moved in so many different directions. We didn't even have masks. You know, we've forgotten that, haven't we? We didn't have masks. We didn't have the PPE to be able to give our hospital workers gowns and things like that. We surely didn't have the antibodies and all the different things that we have today. And absolutely, if you'll just step back from it, that's all you got to do, and think, how long did it take us to develop a vaccine? What would we have done if President Trump had not poured billions into trying to develop that vaccine and develop it right then? And now we have a new administration, and we need to be respectful to the old and respectful to the new, and be willing to work with the new just as much as we would be willing to work with the old. You know, we need to go forward. Absolutely, without any doubt, the 1,000 deaths that we have had in the last 2 months or so are astounding, and they're sad. And they're sad because I know the people we're losing absolutely are the wisdom. That's why we came up with Operation Save Our Wisdom. That's why we're running to the fire in West Virginia. And that's why we're on every nightly national broadcast all across this country, because our great people have run to the fire, and they are stopping this and saving all kinds of lives. Now, West Virginia is not immune. And West Virginia has led the nation on many, many, many aspects. And we're going to continue to do so. But all West Virginians should listen to me and listen really closely when I tell you this killer is not some hoax. Well, they didn't land on the moon. I mean, for a long time, many were going around saying, oh, this isn't real. And they were doing it all across our land, all across West Virginia, all across the United States of America. Well, it bit a lot of people, did it not? And now we have bridged ourselves with that pain to a vaccine. And absolutely, surely to God above, we are not going to let these people die in vain. We're going to remember them. We're going to thank them for all that they gave us every day. And we're going to be sad that we miss them. But we're going to know that in some way, somehow, they're in God's plan and they're in a better place. But the families are still hurting, and we want to try to help them in every way. This is tough stuff. It's tough stuff, West Virginia. Absolutely keep your chin up and your mask on. We really need you badly. We don't want to lose any more. And thank you, Kenny, for the questions and your concerns.
All right, thanks, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a couple of questions about our permanent clinics for the minority communities that we talked about earlier. So do we know as of yet how many shots each one of these permanent locations will have on a weekly basis? And are there any sort of, age or health prioritizations for the folks that can utilize that clinic, or is it just going to be open to anyone from those communities? Thank you.
General, you can help us more than anybody here, sir.
Yes, sir. Charles, we're still working with Reverend Patterson on numbers for each of those locations. We'll also continue to work. Reverend Patterson has agreed to participate regularly in the interagency task force so we can work through those questions that you asked, to include the age demographic as well as the health risks. So there'll be more to follow on those as we continue to work with him on the process. And I don't know, Reverend, you may have some other points to make there.
Yes, I'm glad that you mentioned clinics. What we're doing for this will be mainly at a large church or a large community facility. For example, tomorrow we'll be testing at Heart of God in Charleston and Beckley, and we were there yesterday. So it's going to be facilities like that that are really in the middle of community permanent places that we will conduct the vaccination. But in order for us to really deal with the disparities and the health outcomes of people of color, it is going to require some permanent facilities that are located in communities of color. So I'm glad you asked that question.
All right, thanks, Charles. Next to Brendan Tierney with WSAZ.
Good afternoon. Brendan Tierney with WSAZ News Channel 3 here. Governor, you talked about vaccinations of teachers and how you did 50 plus first, then we'll start focusing on people under the age of 50. And I was actually contacted by a teacher who's under the age of 50, signed up before the deadline and was told, okay, you're on a waiting list. As soon as there's a shot available, we'll get it to you. But she hasn't gotten that call yet that there is a shot. So what's the timeline to get all of those teachers under the age of 50 vaccinated at this point? And are you concerned that it might lead to possible outbreaks and spread within schools if not all staff members are vaccinated? Thank you.
Brendan, I think really just this. I think, if you pay absolute attention to all the things that we say, the first thing is, am I concerned? Well, of course I'm concerned. I'm concerned all the time because I tell people all the time, there's no 100% here. There's no perfect answer. All we can do is dramatically reduce risk. And then the next thing, if you've just watched and listened, I say repeatedly, all the science, all the medical community and everything tell us that the transmitters of our children 8th grade and down is so unlikely. I mean, it can happen. Sure, I guess it can. It can happen that we'll be hit by a meteorite today, or it can happen that more are going to die. More are going to die because of our elderly or whatever it may be. All we can do is the very best that we're capable of doing. And in this situation, Brendan, here's what I would say to that teacher that's 50 and under. I would say pre-register. As quickly as we can feasibly get there, we will absolutely, I would love it. I mean, you can't imagine how many times, listen to these national broadcasts, how many times I'm saying, that if we had the vaccines, we could get everybody 65 and older vaccinated by Valentine's Day. If we had the vaccines, without any question, we could double back and absolutely get all the teachers under 50. We could get absolutely all those that we missed, that decided they didn't want the vaccine, and now they do, that are over 50. Same with our service personnel. If we had the vaccines, and if we had the vaccines, we know, Brendan, that if you're 70 years of age and you get this, you're going to die, or an awfully, awfully good chance. And we know if we've only got now a box of vaccines with 10 in it, we know we'd be a lot better off to try to get that to somebody that's 70 years of age, and we need to get that there very quickly. We're getting there just as fast as we possibly can. We're calling for more vaccines each and every day, and absolutely with all in me, as quickly as I can get back and get all those under 50 and all those that declined that were above 50 at the schools, we'll do it. Because absolutely with all in me, I want our kids always in school and as safe could be. So believe me, they haven't been forgotten. But in the meantime, please continue to register and everything so we can get you in the system. And you're classified as essential, and we'll get there really quick.
All right, thanks, Brendan. Next to David Beard with the Dominion Post.
Hi, I wanted to raise a couple points about the Johnson & Johnson vaccine that Dr. Marsh just talked about. And I got to look down at my notes here for a second. He mentioned it's 66% effective for, I think, moderate symptomatic disease, about 85% for severe illness, and I read it's about 72% effective overall in the U.S. So the first point I want to raise is, could we learn more about why there's such a variation in the effectiveness depending on the degree of the disease? And the second point is looking just at that lower figure, 66%. I think flu vaccines are actually lower than that, around 50%. But people who are already, I guess, skeptical that these vaccines might see that 66% and wonder, well, that's only a little better than a coin toss. Is it going to help me? Especially if it's they compare it to the Pfizer and Moderna vaccines up at 95%. So is there a concern that people might say, I don't want that crummy vaccine, give me the good one? And how would you deal with that if that crops up? Thanks.
Okay, Brother Marsh, you're the one that started this brush fire.
All right. So, David, as I understand it, and we haven't seen all the data yet, but across the world, as we look at all comers, including people over 60 years old, then the effectiveness of the vaccine was 66%. In the United States, the overall effectiveness for moderate and severe disease, and that's what they judge by, and at least what's been put out, was 72%. But people severe disease only in the US was 85%, which is very favorable and, in that range with the Pfizer and the Moderna. The beauty of the Johnson & Johnson vaccine is it's a single dose and it can be transported at room temperature. So it is much more mobile than the Pfizer vaccine for sure, and even the Moderna vaccine. And I think that, the point here is we want to make sure that we are moving as much vaccine to people as we possibly can. And obviously, the Johnson & Johnson vaccine has not been FDA approved yet. It hasn't gone through its emergency use authorization, and it will need to do that. And the prediction is the next 3 weeks that will happen. But this is just another opportunity for us to put vaccines in arms of people. One thing that's really important and very interesting, and this is an incomplete story, but I think it's worth sharing with people. So the Moderna vaccine and the Pfizer vaccine, after a single dose, have a reported 52% benefit rate, which is half and half. And as you said, the flu vaccine is about 45 to 60%. So it's like half and half. So there is precedent for that. But in the Moderna numbers, if you wait 14 days after the first injection, then the protection is more like 80%. And in Israel, they're using one vaccine dose in a lot of people, and they're getting the second dose maybe a little bit later in some of the people. And they've done some analysis of their experience using the Pfizer vaccine mostly, but they see 18 days after the first dose, they see a 60% reduction in severe illness, hospitalizations included, for people over 60 years old. So this story is unfolding in a really interesting way. And we need to continue, as we talked about, being agile, because these overall rates may not have the same relevance as what we're really interested in, which is keeping people out of the hospital and keeping people from dying of COVID-19. Of course, we're interested in reducing all disease, but the first, priority is to do those two things. And the reason why the Pfizer or the Johnson & Johnson vaccine is different around the world, because different forms of the virus do impact the antibody production a bit differently. So the results in South Africa were less good than the results in the United States. And that's the reason why we were watching that very carefully. And while it looks like that the Pfizer and the Moderna vaccine are still fine for the United Kingdom variant and still have activity for the South African variant, both manufacturers in the messenger RNA vaccine, Pfizer and Moderna, are augmenting, changing some of the way that they've made the vaccine to make it more active for these different variants, depending on what would be necessary. So this is why we have to keep watching and reacting. But right now, getting vaccine in people's arms looks like it's very, very powerful in reducing hospitalizations, reducing deaths.
All right, thank you, David. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. I want to follow up on a question I asked probably 2 or 3 weeks ago that was prompted by Jim Brown, a retired Metro 911 dispatcher here in Kanawha County, who is perhaps best known lately for getting first responders or dispatchers classified as first responders, a very important law that got passed last year in the legislature. Jim was homebound, bedridden, and he couldn't get out to get any shots at any of the clinics. And apparently he got his shots. Somebody came to him. So I'm wondering if we've come up now with a statewide protocol for other people. I would imagine we have a lot of homebound, bedridden people in West Virginia. Do they call their local health department? Do they call the fire department? How do they get in line and get a higher priority for getting their shots?
General Hoyer, please answer, and thank you so much for all that you're doing for the homebound. And I know an awful lot, but I think you'd be better to answer.
Yes, sir, Governor. Thank you. So, Mark, as you point out, we have folks that need vaccines taken to them, working with several key groups, senior services, developmental disabilities councils across the state, volunteer organizations active in disasters. Had a conversation this morning with the staff in our state Veterans Assistance Office. So we continue to pull together those populations that we need to get out to. You make a great point, and we are going to have to get out to folks, as Reverend Patterson pointed out earlier in part of his concept. The mobility is an important part of it. So we appreciate you continuing to bring these to us, and we are continuing to work aggressively to get out to those various groups.
Let me add one thing too. I just noticed, not long ago, NBC did a little piece. It was about 5 minutes on West Virginia and how West Virginia was doing. It was really great, and it showed, people at pharmacies that took on their own to go out and give some shots to people at their homes and so on. So really, I just thank everybody that's really stepping up and doing all that work.
All right, thank you, Mark. Next to Ryan Quinn with the Charleston Gazette-Mail.
Hello, Governor, there's no button on Everbridge to pre-register as, quote, essential. So how are those school employees who register there going to be prioritized? Is it through them clicking that they are an educator? And will you double check that they actually are educators before vaccinating them, in case someone signs up as an educator to just try to get the benefit of prioritization? And then secondly, are you saying you can't give a date or even a week or even a month when these under 50-year-old school employees are going to start being vaccinated in mass? You technically did, perhaps for good reasons, prioritize older people in the general public above these younger school employees, and you may keep prioritizing those in the general public for I don't know how long. So when exactly are you going to start vaccinating those under 50 school employees?
Well, Ryan, I'm going to defer to General Hoyer on a bunch of this, but General, if you could jump in and maybe you can clean it up and everything. But I can tell you that as the system is set up, it does do things as far as for the educators and everything. But General, jump in please and talk about this, and maybe I'll follow up.
Yes, sir, Governor. So, Ryan, right now we continue, and we don't see any change at this point to get the 23,600 doses plus what we have been told we will get next week with the additional 3,700 Moderna doses. That doesn't give us a significant amount to work with. We have 350,000 West Virginians by census data over the age of 65. So we're working to prioritize those populations to spread some vaccines out to continue to address what we're working with Reverend Patterson on key groups such as minority groups. We have, we estimate maybe as many as somewhere between 400 and 500 a week that we'll have to add to get essential vaccines to those who continue to come into nursing homes and assisted living facilities. And again, everything is focused on what Clay talked about earlier. We know that 77.5% of our deaths come from people over the age of 70. We know that 14.5% come from the ages of 60 to 70. And we know that in congregate settings, those age groups are most hospitalized and die the most. So we're doing the best we can to spread out those 23,600 plus whatever else they send us going forward.
And come back to me, Jordan, just one second. You know, Ryan, I think there's a place, you know, on the system, the Everbridge system, that says, you know, where you can check, you know, if, you know, your occupation, and also right with that, you can check the place, or you can identify the place where you work. And as we review all this through the systems and everything, you know, we'll pick up on that there. But Ryan, in addition to that, let me just say this. Let me make it really, really simple. You know, right now with the 23,000 doses that we have, we can't get to everybody today. The science tells us that the school has been safe from the very get-go, whether we vaccinated anybody or not. And we did all that we did over the top. But let me tell you one more thing, and this is just how I feel. As we continue to scream for more and more and more vaccines and everything, if we can glean off vaccines, and we will, we're not going to wait months and months and months and then decide, well, we're going to go back and get the teachers that are under 50. We're not going to do that. But as soon as I can possibly see my way forward, that we can glean off some of the vaccines that we're getting, if we're able to get more increases in our order size, we'll go back and get them.
All right, thank you, Ryan. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello. So as far as getting vaccinations out to all 55 counties next week, you all have said that will be based on population. Can you give us a number of, you know, is that one vaccine for every, you know, how many people that live in that county? And if, you know, that equation is impacted by the number of elderly people in that county.
Governor, I can handle this if you want.
Yes, sir, please.
Yeah, so June, to your point, you are correct in that we have broken down by census data the population in each county over the age of 65. So we'll be focusing by percentage, breaking out what we have to take a certain number off of the 23,600 to get to key populations like additional nursing home doses and those types of things that we need to address. And then based on percentage of population. But the other thing that we did is there are some counties where the percentage of population over the age of 65, based on the 23,600, would only provide a small number of doses. So we've added to those doses to make it a reasonable number to be able to administer within that county. So we do look at the data, and we are working it based on those percentages, and age is our primary factor.
All right, thank you, June. Governor, I'll turn it back to you.
Well, again, I thank everybody for their contribution today, and you know, I especially thank Reverend Patterson, and you know, seeing him was great. You know, I do want to just clean up one other thing, you know, and remember, you know, to try to push everybody towards getting registered. We'll use the data and use the data, you know, as we should and properly with Everbridge, and you will not lose your spot in your wait list area. Please, please, please remember that, and you know, but to continue to register, it would, I think it'll be beneficial to you in every way. All I can say over and over about the vaccines is just this: as we go forward, we're just going to continue to push the federal government in every way to get more and more vaccines. I congratulate everybody that's moved to where we've got 84,000, almost 85,000, of our people that are in excess of 65 and older that do have a vaccine in their arm, and 16,000 plus of them that have the second vaccine in their arms. And that is absolutely going to save a bunch of lives. At the end of the day, honestly, without any question, because we're looked at through a microscope over and over, but West Virginia is truly leading the way, truly leading the nation and leading the way. But all of us know, and every last one of you should know just this: it's not enough, and we can't make it perfect. Absolutely, the decisions that we've made are leading the nation, but they're not perfect. And we will continue to work and run to the fire and do any and everything we can do. I don't care how tired we get. I don't care about any of the excuses. We will continue until this thing's over. It's not going to be perfect, but we got a lot of people making the right moves on the chessboard, and it reflects across our whole nation. So thank y'all for each and every one of you for all that you're doing, and we're going to continue to do everything in our power to make it as good for West Virginia as we possibly can. Thank you a bunch.